Hello, my name is Jazmyn. I'm in HEP 240 section 4001, and for my media project I will be answering the question, what is an anesthesiologist? Anesthesiology is my dream job, and I'm glad this project gave me the opportunity to do more research on it. So what does an anesthesiologist do? An anesthesiologist is someone who meets with all of their patients pre, during, and post-surgery to make decisions on their healthcare, proper medicine, and anesthesia. They also monitor vitals during their patient's surgery, ensure proper recovery after surgery, and manage their patient's pain management. There are also a lot of other things that go into anesthesiology, but these are the main responsibilities that the job entails. An anesthesiologist can work in a variety of settings. The most popular setting is hospitals, but they can also work in physician offices, clinics where they put input IVs, outpatient surgical centers to ensure recovery, academic institutions to teach the practice, and medical institutions where they monitor hands-on students. The education requirements are the same for most positions in the medical field, but licensing can vary depending on the specialties and subspecialties of the anesthesiologists. Anesthesiology requires a bachelor's in science and health studies or any other pre-medicine pathway. This degree takes 4 years to obtain. It is offered at most universities, and it covers the basics of health and medicine such as biology, chemistry, and basic healthcare. After the undergrad degree is completed, a degree from medical school is required. This also takes 4 years to obtain and covers more specific topics such as pathophysiology, biochemistry, pharmacology, and anatomy. Additionally, medical school offers more opportunities for internships, clinical experiences, and hands-on learning. After graduating medical school, 4 years of residency in anesthesiology is required to advance in the field. Residency involves evaluation in clinical care and specialized care. Most anesthesiologists then go on to get their board certification in the field to practice in advanced settings such as hospitals. There are many certifications you can get, especially in more subsidized specialties, but the board exam from the American Board of Anesthesiology must be completed and passed to work in a hospital. According to the ABA, over 75% of anesthesiologists are board certified, so this is a popular route to take. There are many specialties that an anesthesiologist can focus on. Each one requires their own certificate through the ABA. Some of these specialties include pain management, which deals with pain-reducing drugs, cardiac anesthesia, which specializes in anesthesia for heart patients, pediatric anesthesia, which deals with children, neuroanesthesia, which deals with the brain and spinal cord, obstetric anesthesia, and critical care medicine, which deals with traumas. Some subspecialties require an extra year or two of fellowship, which includes extra training. Some of these subspecialties are critical care medicine, hospice and palliative care medicine, and pain medicine. There are many different paths one can take as an anesthesiologist. Anesthesia can be a rewarding line of work, but there are both pros and cons to this career path. There's a competitive salary and job security, which ensures that medical school debts will be paid off fairly quickly. Anesthesiology also has a pretty flexible work schedule, which means that anesthesiologists can take vacations, have personal time, and can still care for their families and spend time with them. With increasing use in technology in the medical field, anesthesiologists always have access to new devices that will help them be more accurate with patient care pre, during, and after surgery. With this job, anesthesiologists can also work in multiple settings, which creates a diversity in the workplace. However, with every pro, there is a con. Anesthesiology requires a lot of schooling and studies, which takes a lot of time and dedication to the practice. If you don't have the passion for medicine, I do not recommend this career path. Although they have flexible schedules, scheduling is very difficult to come by because there's a plethora of doctors in this field, but not as many opportunities to practice because anesthesiologists are not on-call doctors. Anesthesiologists do a lot of work behind the scenes, but they often go underappreciated when involved in patient care. And finally, the pressure to succeed in this field is very high. There's a ton of liability weighing on you when you're dealing with a patient's life in your hands. So, to summarize, anesthesiologists perform a variety of clinical procedures such as epidurals during birth, intubations, increasing their patients' airways, IVs, and more. They have a flexible schedule that allows for more time to spend outside of work. There are a variety of different settings that an anesthesiologist can work in, not just hospitals. Anesthesiology is a rewarding career as you build a relationship with your patients and help them recover. There's a lot of work and training that goes into this field, so if you have the passion and dedication for medicine, I highly recommend you pursue anesthesiology. Here are all the references I used for this presentation. Thank you for listening.